Okay, so while discussing the scenario, we have already discussed the major criteria. So if out of these cases they have given you, two of these or one of these, then like this is the diagnostic statement. Now you should know that two major plus evidence or two minor plus major plus one major. So you should be able to spot these major criteria. So with cases we have already done the major criteria. Now we're going to talk about the evidence of past streptococcal infection. What is going to be the evidence? So as an evidence we usually have 4 points. Okay, the first one is going to be that there's going to be a throat culture. They're going to take a swab or culture and it's going to be positive for streptococcus pyogenes group A beta hemolytic. It is a group A beta hemolytic streptococcus. Or there is going to be there is this rapid streptococcal test, and then there is this antibody titer, and then there is a recent scarlet fever. Okay, what happens in scarlet fever? There is going to be a sandpaper like rash, strawberry sort of. Basically, strawberry tongue also occurs in Kawasaki disease, but in this case, there is a sandpaper rash which is going to spear your palm and soles. And yeah, so the characteristic is this sandpaper like rash on the skin. So these things. Now, throat culture can be positive. One of either this can be there or this is known as rapid streptococcal antigen test. They either say that this showed the bacteria, or in antibody titer what do we consider? We basically take the anti-streptolysin titer, ASO titers. Okay, ASO titers are classical. They can definitely give this in the SCQ, or they are going to talk about the recent scarlet fever. So these are the 4 points. Either one of these gives you the evidence. Now let's discuss the ASO titer because they're very important. We have a certain value of these ASO titers. So what is the value? The value is that they are characterized as rising titers if they are more than 330 units in children. You should know that. Okay, you should write this down in your answer in your investigation. Okay, I'm just talking about the scenario right now. Or if they are more than 200 units in adults. Okay, and if let's say that you cannot find any ASO titer, then which antibody are you going to look for? Then in that case the antibody which you are going to choose is going to be anti-DNase. Okay, anti-DNase antibody. Anti-DNase titer, but first choice for the antibody is going to be anti-streptolysin, the ASO titer, and these are the values. More than 330 in children and more than 200 in adults is considered to be rising or positive. Okay, so now we have also discussed about the evidence. These points are done. We had 4 points. Now if you are given two major with evidence, let's make up the scenario. If I tell you that there is a child who has you know migratory arthritis, okay, and he is having migratory arthritis, and he is having, let's say, a murmur, a pansystolic murmur, okay, radiating to the axilla. And there is basically, he had recent scarlet fever. Okay, he had recent scarlet fever. So what are you going to pick from this scenario? You're going to say, okay, this migratory is a part of cases, so this is major. This pansystolic is a part of carditis, the C in cases, this is also major. And this recent scarlet fever is the evidence. So we're going to say that two major plus evidence is going fulfilled. So this is rheumatic heart disease. Okay, this is how we are going to diagnose that the all these things are going to fulfill. So this is a rheumatic heart disease. Or there can be one more thing, that they can give you two minor or one major. For this you should know the minor criteria. So what is the minor criteria? Basically the minor criteria is very simple. They usually don't give you minor criteria in your scenario. They you can easily diagnose this on the basis of two major plus evidence, but still you should know that FRAPP is a mnemonic fever. Okay, raised ESR titer. Okay, and then there is going to be A for arthralgia. Okay, And then P for you can say prolonged PR interval or heart block. Okay, I'm writing this as prolonged PR interval because P is a part of mnemonic. So prolonged PR interval basically is your heart block, first degree or second degree. And then with the other P we have a previous history of rheumatic fever. Okay, so these are the 1, 2, 3, 4, 5. These are the 5 things which form a part of the minor criteria. So any two of these are given with one major, then you're also going to say that the patient has rheumatic heart disease. So how are you going to diagnose? If you are given two major plus evidence, one evidence, or if they have given you two minor plus one major, then in that both cases you are going to diagnose this as rheumatic heart disease. So this is how you're going to diagnose the scenario, pick up the disease from the scenario.